Good afternoon, everybody. First of all, I want to thank the committee for inviting me to present our work on the WIC revisions. And so I was asked to talk about the vendor response to the food package revisions. And the vendor here means a food store. It's a WIC term for a food store. And this work is part of a bigger evaluation effort that we have completed thanks to ERS research support. And while today I'll focus just on WIC vendors, we have done a variety of studies looking at access to food and changes in food purchases among WIC participants. So just to give you a list of projects that we have completed, and the last one is still ongoing. So here's how we came to study WIC vendors. When the regulations came out about the upcoming changes in WIC, we were doing work in food stores in low-income neighborhoods, and we could see that there was, very limited availability of healthy foods, and we felt like there would be potential increase in the demand for these healthy products that WIC was promoting. At the same time, we had concerns about the capacity of small WIC vendors to adapt to these changes and to provide healthy foods to participants. So this motivated our study, which I call a small vendor study. And the small vendor here means just a convenience store or an independent grocery store. So the data that I'm presenting today is basically for convenience stores and independent grocery stores, not supermarkets. And so the study looked at a variety of questions, not just WIC. And so one of the most important questions was why we saw this limited availability of healthy foods, and whether it was the demand side or the supply side that explained it. And but for the purpose of today's talk, I'm just looking at the implementation of the WIC revisions. So like I said, we only looked at small stores, and it was a pre and post non-randomized study, and in 5 diverse Connecticut towns. So again, data is only for Connecticut, for the state of Connecticut. And in these 5 towns, we went to all WIC stores, small stores, and matched them with non-WIC stores, non-WIC controls, and we matched by type of store and neighborhood income. So we did in-person interviews one-on-one and with store owners or managers. It was a little challenging to actually develop the survey because there wasn't much in the literature. And so we used a variety of sources to develop our survey, which we provided in English and Spanish. So we had a bilingual interviewer doing interviews, and we had 2 versions. So the longer one was for WIC stores, which included a lot of questions related just to WIC. And so the interviews were fairly long and comprehensive. This chart gives you data on our participants. So at the baseline in 2009, in the spring of 2009, we interviewed store managers or owners in 35 WIC stores and 33 non-WIC stores with fairly high response rates, particularly in the WIC community. In 2010, so that was the spring of 2010, we went to the same stores, had some dropouts, and so managed to have a sample of 59 stores. So most of interviews were completed in English, but at the same time, most of our participants were actually the first generation immigrants. And some of them lived in the same neighborhood where the store was located. And when we talked about bias, actually, I just had this thought that we had a lot of stores located in African-American communities, but none of the stores, like managers or owners, were actually African-American. So I felt like there was this disconnect between who owned the stores, who served WIC participants, and participants. So most of the stores were convenience stores and located, like I mentioned, in low-income neighborhoods. So next couple of slides, I'm going to show you data on changes between 2009 and 2010. Once again, the spring of 2009, about 6 months before the changes were implemented in October. And the spring of 2010, about 6 to 9 months after the changes went into effect. And this chart shows you data on availability of all these healthy foods that WIC was targeting. And in Connecticut, WIC stores were required to provide fresh fruits and vegetables, at least one variety, in 2009, and whole grain bread. So as a result, not surprisingly, we see that after the change went into effect, every WIC store had fresh fruits. Every WIC store provided whole grain bread, and we don't see any changes in non-WIC stores. So that was an important finding. We asked participants about their kind of perceptions of demand changes, and so again, you see this difference between WIC and non-WIC stores, and for foods targeted by WIC, we see changes in demand, improved demand for purchases of healthier foods in WIC stores, and none of them in non-WIC stores. And this is what we would expect based on changes in the program. So next, we also looked at suppliers and changes in the supplier network. Small stores usually have a variety of strategies they use. So for example, with produce, usually they rely on self-supply, and they just go to wholesalers or even Walmart and to purchase their produce. And with other products, a lot of times, for example, bread, milk, they have a convenient delivery. And after the changes, most WIC stores had more suppliers because they had to provide basically more products. And a lot of stores, more than half of the stores, had to make some changes. For example, they reduced space in their fridge for milk. They reduced milk to provide more space for fresh fruits and vegetables. Very few of them actually had to buy new equipment to accommodate the changes. And this chart just shows you that on average, the number of suppliers before and after the change, and by product, by food category, and we see some changes, meaning more suppliers. So as I mentioned, pretty much all of the stores had to provide more products, and very few of them actually reduced items that they were selling. So like I said, they had to cut milk and cheese in the fridge to provide more room for fresh fruits and vegetables. They removed some big juice containers, but no particular significant changes. In terms of problems that they experienced shortly after the implementation, I mean, I don't want to talk about whole grain bread, but basically this came up, most of the time. So very few stores actually had problems providing fresh fruits and vegetables. In terms of the workload, of course, they had to provide more training to their staff and to find new suppliers. So again, whole wheat bread was an issue. And to figure out how to work with these new vouchers, CV cash value vouchers. So there were some issues in the beginning. And in terms of profits, so obviously if the program changes negatively affected their profits, we would see potentially some stores leaving the program. So this data shows you perceptions of their profits. So we didn't actually have data on profits, but perceptions of profits since the program changed, since the revisions. And so the majority of stores didn't really see a negative effect that they would attribute to changes in WIC. And just to remind you that this study was kind of, shortly after the Great Recession, so during kind of a downturn in the economy. So a lot of stores said that, yeah, they lost money, but they didn't attribute it to WIC. And in terms of products that they were usually citing, and again, not a lot of them, as you see, based on these percentages, produce, just a lot of stores didn't really know how to handle spoilage, and it just was a new product for these small vendors. At the same time, on the other hand, a lot of them were surprised how well they were selling fruits and vegetables. And so a new product and they just didn't realize how much money they could be making on, for example, bananas at the cash register. So again, the initial difficulties mostly just spoilage with produce and finding supplies of whole grain products, and some problems with customers complaining about whole milk. But overall, at the time when we were doing these interviews about 6 to 9 months after the change, the majority of stores, small stores in Connecticut, felt like the change was positive or neutral to their business. And if they had any problems, they solved them within 3 months of the implementation. And no store in our sample at least dropped out from WIC by choice. So there were some that were kicked out because of their violations, but they all wanted to be on WIC, they all wanted to participate. And they just had to adapt and change what they were stocking in stores. And so this chart gives you data on all WIC-approved stores in the state of Connecticut a year before the change and a year after the change. So this is based on administrative data on WIC stores, and that I get from the state office, and I just coded every store by type. So pharmacies, based on their name, basically. CVS would be a pharmacy, and supermarkets, kind of chain supermarkets, and small vendors would be everything else. So you can see that there's no change, basically, at least in the state of Connecticut. It's kind of consistent, about 100 pharmacies that are WIC approved in the state, about 200 supermarkets, and about 250 small vendors. So we don't see any dropouts. So whatever concern we had that a lot of stores would, potentially, particularly small stores, that they would, be not happy with the change, that they would drop out, this didn't happen. And this chart gives you kind of a longer time period, over 6 years, and again, you don't really see any change, any kind of dropouts for small stores in particular. So I feel like this concern was not valid, and we're happy to see that the small stores basically learned how to adapt. And I would say this would be my prediction for any change that we would introduce into the program in the future. For supermarkets, so I'm a member of the WIC Advisory Council, WIC Vendor Advisory Council in Connecticut, and so every supermarket, they have their representative at all these meetings. We have a quarterly meeting, and so they talk about kind of challenges. So we didn't do a study of supermarkets, but just based on kind of this anecdotal data. Their challenges were mostly with participants' confusion about what was eligible, what was approved, and what sizes, what brands, what were kind of least expensive brands that would be allowed, and checks, kind of processing checks, again, in the beginning of the implementation. So very different problems than in small stores. But as of now, everybody's happy, and so no, for example, they're introducing a lot of store-specific brands that are WIC approved. So in 2010, I think we only had 3 brands, like generic whole wheat bread, and now we have maybe like 12. So stores, supermarkets are coming up with these new products that are getting approved with WIC. And I just want to thank again ERS and my research team. Thank you.
Does anybody have any clarification questions? Thank you. So now, last we'll hear from Ed Harper.